Differences we have in genetics and the different environmental stressors that we put upon ourselves will determine which part of your body declines the fastest and results in the manifestation of a disease or symptoms. But we have to be clear that the loss of adaptation is the problem, not the symptoms or the system in your body that's dysfunctioning the most. So if the immediate health problem that you have right now is cardiovascular disease and you have an elevated coronary calcium score, plaquing, high blood pressure, and all of the signs and symptoms of heart disease, does that mean everything else is perfectly healthy and you just have a heart disease problem? No, the body is less healthy and the heart disease or the blood vessels are manifesting as the most immediate visible problem. So then the question is, what happens first? Well, one thing we know is that the two systems in your body most responsible for adapting to the world that you put it in is your central nervous system and your immune system. And they're so tightly related that we actually consider them one system, which is interesting because 30 years ago, there were scientists that were saying the two systems in the body that seem completely unrelated to each other are the nervous system and the immune system. And now it's completely gone the other way to the point where we actually think the immune system and the nervous system are the same thing. One uses, let's say, a liquid or a blood vessel determined way of communicating. The other one uses electrical cables as a way to communicate. But they're both intimately connected.